Hi, everybody. Thanks so much for joining us today. My name is Nicole Lamberson. I was trained as a physician assistant, and I volunteer doing outreach for the film Medicating Normal, and I host conversations like the one we're going to have today. Our guest today is Dr. Russell Kennedy, aka the Anxiety MD. He specializes in the art and neuroscience of helping people recover from anxiety disorders. And he knows anxiety from the inside out, as he developed his own anxiety disorder as a result of growing up with a dad with severe schizophrenia. He has degrees and advanced training in medicine, neuroscience, and developmental psychology. He's also a certified yoga and meditation teacher, and he was a professional stand-up comedian for over a decade. So I'm expecting some jokes or something funny in this interview. He has an award-winning book, an audiobook called Anxiety RX, where he gives a unique and never before seen understanding of what anxiety truly is and how it can be successfully treated. He wants to make sure that nobody has to suffer with anxiety as he did. So welcome, Dr. Kennedy. Thanks for joining us. I'm so glad you're here today.
Thanks, Nicole.
Yeah. So I guess let's start with your book, Anxiety RX.
Okay.
What did you write it? Like, what was your idea for who your ideal audience was? And what did you really want them to get from the book?
I think I wrote the book mostly for me, actually. I mean, I don't think I had an idea. I mean, some of the business coaches that I've kind of talked to after that, I've said, well, what's your ideal client? What's this? It's like, I don't really have one. It's basically my journey with anxiety and, being a doctor for 22 years and helping people with anxiety, helping myself out of anxiety, and just the route that I took that was very atypical according to traditional standards, but it was the one that actually worked after, 30 plus years of trying every type of, ACT, CBT, HIJK, LMNOP, you name it, I did it. There's one joke for you. And it just was my frustration and my patient's frustration. When I see them, it's like I went to a therapist for 5 years, 10 years, 15 years. And yeah, it helps at the time, but I'm really not a whole lot better if I look back at myself 15 years ago. So it was like, can I find a way of really finding what anxiety truly is, which I believe is old alarm and wounding that's still stuck in your body? Can we bring that out and feel it to heal it in a way so that we're actually dealing with the underlying root cause rather than most traditional therapies that are trying to get you to think differently? And it's very, very difficult over the long term to think in a way that's different than your body feels, especially if you're a sensitive person, especially if you have a sensitive nervous system, because you will think exactly the way your body feels.
Okay. So you struggled for 30 years with anxiety yourself. I mean, tell us a little bit about your own experience, what that was like. And then obviously something had to shift for you other than everything isn't working. So how did you come into this new space of, I'm going to try something different?
Well, for me, anxiety, if I look back, it started when I was a teenager and dealing with my dad who had severe schizophrenia. So there was a lot of chaos around the house. When my dad was normal, quote unquote normal, he was caring, loving, playful, intelligent, just about everything you want in a dad. But when he would go manic or depressed or psychotic, we would lose all of that. So for me, being a sensitive child, which I always have been, which I still am on some level, is that just to love your dad so much and then have him leave you in a way or become the source of your pain was very difficult for me. So I withdrew kind of my love from him in a way, just because it was just too painful to love him that much and have him suffer, see him suffer so much. So that started the cascade, because there is only fear in love. And sometimes as a medical doctor and a neuroscientist, I want to have a bit of a seizure when I get into my more woo-woo parts, but there is only fear in love. So if you pull away from love, either for yourself or for other people or both, the only thing that's left to fill you up is fear. So then we sort of try all these traditional methods to kind of calm fear, which are usually cognitive on some level, which are usually temporary. Not saying that CBT and ACT and all those things don't help. They absolutely do, but they're not really getting to the root cause of the problem. So the root cause of the problem for me was a separation from myself because I stopped trusting love. There's a quick rant for you that says just about everything that I felt when I was growing up.
Yeah. And I'm sure, I mean, as you were describing that, I was thinking like so many other people's parents, abandon them in other ways. It doesn't have to be
Yeah.
schizophrenia, it could be they
Alcoholism. Yeah.
worked
Yeah.
constantly
Yeah.
or yeah. Okay. So in our society, we're sort of trained to think of anxiety as this mental disorder, like our head is separate from our body.
Right.
And, um, what would you say to that? I mean, what is your opinion of what exactly anxiety is other than just a mental disorder?
Sure. Well, the short answer again is a separation of your mind from your body, just as you said,
Mm,
and separation from your adult self, your today self, from your child self. Because if your child self went through a lot of trauma, if your parent was an alcoholic or your parent did work all the time, you didn't feel like you had enough connection, you didn't feel like you had enough love. And us sensitive kids, we need more love for sure. And we're the ones that more likely develop anxiety. So it's can you give that love to yourself? Can you find a way of giving that love to yourself and joining the adult self with the child self? Because the adult in us doesn't want to go back and visit that bullied or abandoned or neglected or abused child.
mhm,
And the child in us is sort of holding up their hands, waiting for us to come back and connect with them. And they just get louder and louder and louder. And they do that by creating this alarm that's in your body. And then when your body goes into fight or flight, there's very little your mind can do. Like you can say, relax, calm down, whatever, but there's very little your mind can do at that point that's really going to make a huge difference
mhm,
other than becoming aware. Okay, this is what happens to me when I get upset. My heart starts racing. My breath starts getting more shallow. Okay, can I breathe in? I always say sensation without explanation. Like, can you move into the sensation of your body, even if it hurts, because it probably will hurt, but can you stay with that sensation? Because that's how you learn how to metabolize anxiety and alarm. Otherwise, if every time you get alarmed in your system, you go up into your head and you start ruminating, this alarm that's in your system never gets touched. And if it never gets touched, doesn't even have a chance of healing. So it's basically developing the courage to say, I'm going to go back into my old wounds. And sometimes you need a therapist. Like, if you've had severe emotional, physical, sexual abuse, you can't do this on your own. Like, you need some help. And it's going in and getting that help from a supportive figure. I like the two therapies that I really like are somatic experiencing and internal family systems. I find those very helpful. I did psychedelics myself, which helped me in a way and hurt me in a way. So it's not like I don't really recommend psychedelics,
mhm.
certainly not as a first line, because I think in the society we're starting to think, oh well, I need a quick fix. I need that dopamine hit. I don't want to go through years of therapy. I just want to take ayahuasca or LSD or whatever. Excuse me. And it doesn't work that way. It's taken you decades to become this anxious, depressed, eating disordered, all that kind of thing. It's going to take a while for us to start shifting those subcortical, those deeper structures in your brain that don't actually understand conscious words. They don't understand language. Their language is feeling. So we have to change this feeling in your body, this alarm feeling in your body, with a different feeling. And that's how we change the deeper structures of your brain. We do it through changing your feeling and changing your thinking too. But we need to change your feeling, because if we don't, you're always going to be treading water. Like the little analogy that I draw is you're in a rowboat, it's got a hole in the hull and it's filling up with water. And this water coming up makes you feel anxious. So you bail it out and you do cognitive therapy and you bail it out, and it does help you feel better in the short term. But until you actually go under and patch the hole in the boat, which is basically going under everything, finding this in your body, healing it in your body, then you actually patch the hole in the hull. Then you stop the problem at its source, as opposed to just bailing water. Because if you're always doing cognitive therapy, you're going to be bailing water for the rest of your life. And that was the position I was in for 30 plus years.
Yeah. I mean, that's just makes me think of so much of medicine. What we do wrong is we're trying to like put band-aids all over stuff instead of like healing the actual wound,
Yeah.
whatever's causing it. Why do
And
you
that's a
think?
great point. I would love to jump in there. Just I
Yeah,
know
sure.
I would love, because the way doctors are trained, the way we're trained is to fix symptoms.
Mhm.
And the fastest way to fix symptoms is with a medication, because it does appear to fix the symptoms. So we're trained in this, 7 to 10 minute model per patient. We have this, there's a medication in the back of our mind. As soon as someone comes in, I have a bladder infection. I have a sore throat. I'm depressed. The first thing that comes into a doctor's mind is, okay, these are the list of drugs that I could use. It's not like, okay, what happened to you as a child? It's none of that stuff. And to be honest, I think we're being a bit hard on doctors in a way because that's how we're trained. So yeah, we need to change the system. We need to make it more trauma friendly for doctors because most illnesses start with trauma. And I see that very, very frequently. And just training doctors on trauma, knowing that they don't have 45 minutes, they don't have an hour to deal with a patient's trauma. But what they can do is become open to somatic therapies, IFS. They're getting more open to psychedelics, that kind of thing. This is a way almost saying, look, I don't have the training or experience to do this myself, but I do know people that do. And can I, rather than saying, oh, somatic therapy is a bunch of witchcraft or whatever, that's where we have to start changing the system, is changing doctors' attitudes. And frankly, from a medical point of view, the patients that had the most childhood trauma were the ones that were coming in over and over and over again, because the medications I was giving would work only temporarily, or they wouldn't work at all, because we weren't treating the underlying cause. We weren't treating their sexual abuse. We weren't treating their physical trauma. We weren't treating their addiction. We were treating the symptoms. So you never actually get to the root cause. So I think we really need to show doctors that there's a different root cause to how you were trained. And can you, when you recognize that, because this is one of the other things too, I'm really passionate about this, as you might tell, is that when I see a patient who doesn't fit a pattern of an illness, it's just really like, I've got my ears are itchy and my teeth don't, just all these strange symptoms.
Yeah.
I think childhood trauma, and I'm almost always right, because physical illnesses tend to present the same way. Gallbladders tend to present the same way, gallstones. So if something presents in a really strange way, think childhood trauma, because that's probably what you're dealing with. And also think, I don't have the training to deal with this. Who are people in the community that are much better at doing this than I am? Before you start writing your Celexa and your SSRI or SSNI, like, just try that first. Now, I'm not against medications by any means, because I think they're life-saving in many, many cases. And I've witnessed that personally. But it's just because the doctors don't have the training to understand that what they're seeing in front of them, this 45-year-old who keeps coming back with his recurrent back pain, their x-rays, their CTs are perfect. Think childhood trauma, think wounding, and then send them to somebody who can actually fix the root cause of the issue, rather than just giving them painkillers. Because those patients are the ones that are hardest to deal with, because as a doctor, it's like, you don't want to keep giving Vicodin. You don't want to keep giving, opiates, because as a doctor, we're trained like, these are addictive. These cause problems, and we don't want to do it. But if we have no other option, this is what's going to get prescribed. So that's my little rant again. So,
oh no, it's okay. So a lot from that just came in my mind that I want to ask you about or get you to clarify on. But from things that you explain, then I guess, are you a fan of like ACEs, or the adverse childhood experience sort of scale, to sort of, predict who is going to be most affected?
to some extent, yeah. But I think there's things the ACEs miss. I think there's things in the sensitive child. The ACEs don't have anything about, did you have a mother that you felt completely mismatched with? Did you feel like you were the odd man out when if there's 3 kids, you were the one that always got the short end of the stick? These things for a sensitive child are really traumatic, but they're not, again, it's the whole reductionist model of trying to say, okay, let's find the causes that we can actually write down and say, these are the causes. And a lot of them are more of almost a spiritual injury to a sensitive child. And it doesn't take much for a sensitive child to experience trauma. So I think it's really, we look at trauma in this, okay, well, it's mental, physical, emotional abuse. Sure it is. But it's also bullying. It's also abandonment. There's so many other things. Anything that made you mature too early. Like, I have this acronym for ALARM, which is A for abuse, B for, or L for alarm. So L for loss, like major loss, divorce of a parent, loss of your health. A is for abandonment, where you were abandoned as a child, rejection, bullying, or neglect. And then M is anything that made you have to mature too early, become the man or the woman of the house too quickly, look after your parents instead of your parents looking after you. These are all traumas that aren't really, some of them are discussed in the ACE for sure, but a lot of them aren't.
Yeah.
So it's not a bad start, absolutely,
Mhm.
and it's a good way of kind of bringing this into the medical profession. But this was, kind of all the rage because this study came out in 1997, adverse childhood events, and then up until the mid 2000s, doctors were learning about it in med school. Now, I read something just like 2 months ago that said the graduates of medicine today, 50% of them have never heard of the ACE scores.
Wow. Yeah. So we're moving even further away from
Yeah.
understanding.
Because we don't know, like doctors will shy away from anything they don't have training in, right? Because they want to feel confident in what they're doing. And so doctors, if psychiatrists see people going to somatic therapy and IFS and stuff and getting a lot better than what they're doing, because they're trained again in a very pharmaceutical model, then they're going to be intimidated. Then it's going to be like, well, that's witchcraft. That's, woo woo. That's alternative. We don't go there. It's like, well, what if it freaking works? After 30 years for me, the only thing that really helped me was somatic therapy and some internal family systems therapy. 30 years of traditional therapy didn't help me. So, and that's getting back to that's why I wrote the book, is to examine a different way of looking at anxiety. And if we look at it as this old alarm that's stuck in your body, can we treat it that way? Now, here's the thing. We can't separate the mind and the body. Like we can't. It's an academic distinction. But when I tell people, hey, when you feel alarmed, because I like using the word alarmed instead of anxious, because it has more resonance with people, where do you feel that in your body? Oh, it's in my solar plexus or my heart or my chest. It's like, okay, put your hand over that. Breathe into it. Like stay with it, as opposed to going into your automatic reaction, which is going in your head and worrying, which again will not get you anywhere but more worrying.
Yeah. I'm wondering, like, when I think about you describing all this, though, why do you think then, if it's so uncomfortable, like these traumas that people had, how people sort of like repeat things, or they, for example, if they had an absent father and they're a woman, they sort of seek out in their adult life relationships with men who are emotionally unavailable, even though it's like recreating the anxiety and the trauma. Why is that if we're trying to avoid being anxious?
But we're not trying to avoid it. And the thing is, human beings equate familiarity with security. So if you were familiar with an abusive alcoholic father, you will unconsciously replicate that in your adult life. Freud called that the repetition compulsion. And it is a very prominent part of trauma, in that we look for the same thing that traumatized us unconsciously, and we gravitate towards it because what was familiar to us in childhood, the brain will equate with security, even if it was abusive. There is some kind of weird system in there that says, okay, being verbally abused is safe because it's familiar. So you'll pick a partner that verbally abuses you. So it's not that hard to understand. And then again, there is this more philosophical approach to it, which says, well, we pick these partners in order that we can process those old traumas. Maybe, I think it's more neurological. I think it's more of a programming thing. If you look at like Konrad Lorenz and the ducks, I don't know if you ever have. So basically, Konrad Lorenz, I think he was in the Netherlands somewhere. It's a doctor. I think he won the Nobel Prize too. But basically, he had these ducks that were born, and he kind of took them away from their mother, and he became their mother. So they imprinted onto him. And their mother could be around, but wherever he went, these ducks would follow him, because he was their mother figure. They imprinted onto him. And that's what we do as children. We imprint onto these traumas. If you grew up in a traumatic environment, we imprint and we follow them. And unless we're aware of that, unless one of those ducks said, hey, that doesn't look like a duck. That doesn't look like a mother duck. Let's look over here. But we don't until our lives start falling apart with like depression, anxiety, eating disorders, personality disorders. All this kind of stuff is a direct result of trauma that wasn't healed when you were younger. Now, there are some exceptions to that, but in general, this is what caused it. And this is what the medical profession doesn't understand, is that so much of illness was created before the age of 5 or 10 years old. 80% of your brain development occurs before the age of 5. So if you're in an environment before the age of 5 where that's abusive or neglectful or whatever, your brain learns that life is about survival, and that's the way you will look at the world for the rest of your life. And you're much more likely to become sick, ill, mentally or physically, if you had that first 5 years of life that wasn't secure and safe.
Yeah. Okay, so I've had some professionals that I've spoken to who sort of frame anxiety as like an evolutionary thing that's kind of actually good for us, like that it's like a signal from our body to keep us safe from danger. What would you sort of
Yeah,
say
sure.
to
And
that kind of thing?
if you grew up in a healthy, attached home, I
Mhm,
think everyone has anxiety. Even the most mentally, emotionally healthy person has anxiety. Anxiety is just a part of human life.
mhm,
But if you grew up in an environment where there is trauma and that ground is not so fertile for accepting new things, then the anxiety becomes pathological. So
mhm,
yeah, look both ways before you cross the street is basically a form of anxiety. You walk out on the street and your mother goes, no.
mhm,
So that imprints on you. Okay, anxiety is there's a certain amount of anxiety that's healthy, but when it becomes pathological, which so many more people are being born sensitive now, and the children are exposed to computer screens and iPads and iPhones so early now that they're losing this social engagement system that's wired into all of us as human beings, where we look at someone else and we can gauge how they're feeling by their face, by what's going on with them, facial expression, eye contact, body language, prosody of voice, tone of voice. We detect these things because as children, we were sponges for these things, but our children aren't getting that anymore because they're getting it from screens, and you don't get that same resonance from a screen that you would from a person. So when you don't mature that social engagement system with real human interactions with your peers and with your parents face to face, that social engagement system doesn't mature. And that social engagement system is what you use to soothe other people and what you use to soothe yourself. So our kids are getting more and more anxious because they don't have that platform of security anymore. And there's no boredom anymore. And when I was young, there was boredom. There was, you didn't know. But now with the kids, all they have to do is go on their smartphone. There's no boredom. And boredom is the birthplace of creativity. And creativity, I think, is a huge antidote for anxiety. So
mhm.
if you block these kids from becoming creative, you also, put them on the royal road to becoming anxious.
Yeah, that makes a lot of sense. I just think back to my childhood, like sometimes I long for that time, when you went outside because there wasn't a phone in your pocket and a
Right.
computer and distractions and everything constantly. You mentioned something before about, medications can be life-saving. And I know in your book you say like traditional methods have sort of had their chance, but they just don't work long term. I'm wondering, do you think medications work long term? Or when you say that they're life-saving, you mean mostly like when people are in crisis, but not for, keeping someone on for a decade?
Yeah, it depends. Um, the thing that I found with antidepressants are that in about 20, maybe 30 to 40% of people, they would help.
Mhm,
About 60% of people didn't really do a whole lot for them. Plus, in those 20, 40% of people that it helped, there was a considerable amount of side effects with them as well. So there was a very small subset of people, a very small subset of people that actually did well on the antidepressants long term. And I asked them, like, do you feel blunted? Do you feel, are you having sexual dysfunction? Are you getting a lot of sweating or whatever? And they're like, no, no. Like I have one guy in my mind in particular who did extremely well, over 10 or 15 years on Zoloft. But he's the exception rather than the rule. So it's a matter of, you have to take every case independently for sure. And it's just it is used as a way of numbing symptoms. And I didn't have a problem sometimes with antidepressants when they didn't work as much as I did when they did work, because when they did work, people don't feel the need to go back and deal with those things. Now, some people had horrendous traumas,
Mhm.
and medication may be the only option for them.
Mhm.
But, again, physicians aren't trained in trauma. They're not trained in recognizing it and recognizing the nuances of, oh, okay, this trauma somebody could recover from. This trauma is so deep that maybe they will need medication for the rest of their lives. Maybe, again, but you have to take everybody on their own merit. So I think it's a hazy area. I think medications, are they overprescribed? Absolutely, 100%, without a doubt. Are they very effective and helpful in other situations? Absolutely. Yeah. So it's knowing, I think, physicians that are trauma informed, that know the difference, that can send people out like, okay, this is a trauma that they've had, when they were 12, they were bullied at school. Otherwise, they had relatively normal parents. They felt their attachment style was good. This is someone who could probably recover with some specific, maybe somatic therapy or IFS or something like that, as opposed to someone who was, sexually abused from the time they were 2 or 3 years old. That's a lot deeper. Now, I'm not saying that those people can't heal, but the earlier the trauma, the more deep it is, and the more difficult it is to kind of heal in a lot of ways. So sometimes medications are needed. It's just that getting that discernment among medical doctors to, this person might actually do really well with therapy, and I might be doing them a disservice by blunting their symptoms, because it's their symptoms that drive them to get help. Once the symptoms are gone, they just go back to their regular lives again. And I used to see that all the time in people that I thought would probably be able to have a good chance at healing. And there's a bunch of, like, the cost of therapy, like therapy is like $150 an hour at least. There's so much to this, and you have to take everybody on their own merits. But I think because, the statement I love about medications and physicians is, when you're a hammer, everything looks like a nail.
Mhm.
So we're always looking for a drug solution to that, and in a very timely, cost-effective kind of way, which often doesn't do the patient a lot of favors, especially if they have a trauma or an ailment or whatever that could really be amenable to more alternative methods. Right. Because we only know this. We tend to look at alternative therapies like, I don't know about that. It's a witchcraft or it's crazy. So it's really educating physicians, I think, more than anything else, is that, okay, can we send this person to do 2 or 3 months of a different type of therapy and see how they're doing, rather than automatically what my uncle Colin calls the order of the rotating pen. He's from Glasgow, and he calls it, physicians, it's the order of the rotating pen. Like, here's your prescription.
Yeah. You took SSRIs and SNRIs for like 20 something
Off
years.
and on.
Yeah.
Yeah, I think I would be on, like, I couldn't stand the side effects. So I think I would be, when I had to take them, I was really desperate. Like, I was either feeling close to suicidal or whatever. Like, that was the mark. And I think a lot of people are like that. They're like, let me just see if I can get through tomorrow and without it. And we
Yeah.
put it off and we put it off and we put it off. And then, so I would say over the course of 20 or 25 years, I was probably on maybe 8 different SSRIs, SNRI, and with a little bit of help. But the way I describe it is, it took my anxiety from like an 8 to a 4 or 5. So it wasn't like it was gone. It was better, and I could function a little better. But there's also all sorts of side effects with that too. So
Yeah.
I would be on them for about a year, and then I would go off them. And that was a
Did,
cycle I went on many times.
did you ever have a significant withdrawal syndrome from
Oh
trying to?
yeah. Oh,
Yeah.
for sure. Yeah,
Yeah.
the brain zaps and the sweats and that kind of thing. Oh yeah, without a doubt.
Yeah. I think one thing people don't think about either, like when you were talking about the medication just numbing or blunting, but in my case, I took them for work related stress, which in
Hmm.
hindsight was such a stupid reason to take medication, but uh they actually created symptoms of anxiety in me. I was more anxious. I took benzodiazepines, so the
Okay.
tolerance kicked in, and
Okay.
I thought that anxiety was actually my baseline state, when it was
Right.
actually, from my physiology being intolerance to benzodiazepines.
Yeah.
Do you think a lot of physicians sort of miss that the medications are maybe driving anxiety in people?
Yeah, I mean, it would be the antithesis. That's the word I'm looking for, to how we're trained. We're trained like, hey, this medication will help. Yes, there's side effects to it. Yeah, but it will help. So when people say the medication is actually making me worse, it goes against the underlying principle of how we're trained in the first place. And a lot of physicians take that as like a personal threat.
Yeah.
So when your medication that you give someone doesn't work, or you give someone an anti-inflammatory and they get, a stomach bleed from that, there's always these things in medicine that we are warned about. Like, this is crazy. Like, don't do this for too long. But the thing is, the patients come in and they're in such pain. It's like, I know there's a risk. I know there's a risk of stomach bleeding or whatever, but it's the only thing that helps me. And as physicians want to help people, like, that's the way why we did it in the first place. So we kind of stretch things out a little bit and we give people maybe more medication than what they actually need. But we also have to understand that there are other options. Like, if you say, I can't give you this benzo, or I can't give you this medication for whatever reason, like, offer a different solution. Like, it's,
Yeah.
the people are already coming in because they have anxiety, because they feel like their back's against the wall. If you sort of say, well, I can't give you any of this, but I don't have anything else, good luck, because I only have 7 to 10 minutes with you. It's a pretty tough world to be in. And it's one of the reasons I think physicians burn out, is because we see the effects of these medications over the course of time.
Yeah.
And it's like, okay, if you're trained to give medication and you're starting to see all the negative effects of medications, it's like, why am I doing this? What am I doing this for?
Yeah. Am I even really helping anybody?
Yeah.
Yeah. So let's talk about then the alternative woo-woo, type things that people could be trying or that should be offered. I know you mentioned psychedelics and you said something about they were good and bad. So I'd love to hear
Sure.
about, what the bad was of that, and also maybe define a little bit more about what is family systems therapy and somatic therapy for people who don't know,
Right.
what they focus on.
Yeah. So I guess, and what was the first question? There's two
Your
there.
psychedelic experience,
Right.
yeah, as an
Sure. Yeah.
alternative.
Right.
Mm-hmm.
I mean, I think that it helped me overall. I wasn't quite right for about 2 years after ayahuasca. And 2 or 3 days after ayahuasca, I was feeling pretty suicidal. So, it's not a panacea. I think, again, like I said, people want a quick fix, or they want a fix from their pain. And they've tried the benzos, they've tried the SNRIs, they've tried all this stuff, and it hasn't worked. So they think, well, and then I had my cousin Jeb, 4 cousins 3 times removed, say that, his depression was gone after he did peyote. So maybe I should try it. And I think that it's starting to be seen as a quick fix panacea kind of thing. And it's not, there's risk there. The psychedelics are among the most physiologically safe compounds that there are, but psychologically they can cause some real problems. So, if you have a first degree relative with schizophrenia, that's one of the sort of relative contraindications and that kind of thing. I think microdosing psilocybin, I think, is great because it gives people a chance to just kind of see the other side a little bit and kind of know that there is life outside of their own ego. So I
What
think
is the other side? Like, for
well,
someone who's never tried it,
yeah,
what are you trying to achieve, really?
I think what you're trying to do is see who you really are, because I think when we're younger, and if we get a caring, nurturing environment to live in, we grow into our authentic self. But if we have a parent who's abusive or neglectful or abandoning, we grow into a reactive self. We become people pleasers. We do all these things that we do. We sacrifice our authentic self for a connection with a parent. So when we do that, we become this reactive self, and you can't live in the reactive self for very long without starting to experience anxiety or depression or eating disorders or whatever. So when we can get the love that we need back, we can start developing more of our authentic self than our reactive self. And I think what psychedelics do is they kind of take out that overprotective reactive self, which is often called the ego. They often separate you from your ego, and you get to see who you really are on some level. And then once you see the caring, loving person that you really are, and you've seen it once, you're kind of like, oh, okay, I've been there once, so I know it exists. So I think that that's the benefit of psychedelics in a way. Now, not everybody gets this. Some people have horrendous experience on psychedelics. Some people have the feeling like, I love everything, I'm part of everything, I'm never going to drink again. So there are definite pros and cons to it as well. But it's not a panacea, especially for people with anxiety, because typically people with anxiety crave control and hate uncertainty. And as soon as you take a major dose of one of the psychedelics, ayahuasca, peyote, LSD, or whatever, you have no control. And that can be excruciating for you. And it can leave you with some emotional scars. Like, I talk to people that, are trying to reintegrate into society after psychedelic experience that was just horrible. Wow. So, it's not a panacea. I think that it's an option, and I think it's becoming more medicalized, like ketamine. They're starting to use in sort of medical environments, and it's helpful, I think, for a lot of people, but again, not for everybody. And you really have to go through a really good screening process. And it's in its infancy here, in the medical profession. I mean, back in the 60s, we started to use it, but now we have a lot more advanced equipment, MRI, functional MRI, PET scans, that kind of stuff that we can really see what these compounds do. So, like I said, it's people are desperate. If you've had horrible anxiety, if you're suicidal, like, you're desperate for relief. So, the psychedelics are like hitting an ant with a sledgehammer. Like, it's really like overkill in a lot of ways. And that's why I'm kind of a fan of microdosing, especially like psilocybin or something. You can titrate it a little bit. The thing about the other psychedelics is that you can't really titrate them. Like, even a small dose of ayahuasca can blow the back of your head off. Like, it's pretty intense. So that's the psychedelic wing. I mean, it has its promise for sure. And I think as doctors get more used to it, but again, it's losing the spiritual aspect. As the doctors do it, like, there's no shamans there. There's no kind of spiritual component to it. And, and I think that spiritual component is helpful, because I think that's what the medicine was designed to work as initially, as sort of a shamanic kind of cleansing, rather than, being in a hospital room that's been, decked out to look really calm and peaceful and stuff. But I think I admire any new way of dealing with trauma and stress in medicine, because the way we have done it in the past has not been good. So somatic experiencing is a type of therapy where people recount their pain, emotional pain, through their body. Like, where do you feel that? Okay, it's in your heart. Okay, it's in my heart. So I'll go into, when I use an aspect of that when I treat people. It's like, okay, is it a heaviness, a lightness, a pain, a pressure, hollow, deep? Like, I really go into, and I'm shortening this considerably, but we find, it's got a temperature, it's got a color, whatever. Sometimes it doesn't, but just finding that in your body, I think, is really important, because I do feel that alarm that we have that's in our body is a version of our younger self. The body keeps the score. The unconscious mind is a reflection of the body, and vice versa. So if we have a lot of trauma stored in our unconscious mind, it'll show up in our body, and it shows up as, mental, physical illnesses as well. So it's like finding in your body, and then coming to terms with it, allowing it to be there. Okay, has it changed? And then you can talk about how you were abused by your dad or whatever. And does that change? Internal family systems has a premise that there is a self. There's sort of an all-knowing self energy inside of us that can look after us, and that parts of our trauma have kind of chipped away at the self in a way, by creating these different subtypes of ourselves that are reactive, that became people pleasers, that became aggressive, whatever. And that we can kind of tease out those parts of us and treat them with, see them, hear them, love them, and have protection for them, so that they can come out and fluoresce and be able to show what they initially were designed to do in a protective sense. But now they're welcome. Now they're accepted. Now they can kind of fade into the background. And there's firefighters and exiles and all that kind of stuff. It's not terribly complicated, but it's another way of looking at your trauma that allows you to kind of bring it up to the surface in maybe a safer environment so that you can actually process it rather than just medicating it, rather than just pushing it down. Because pushing the child in you down is the reason why that child is getting louder. It's the reason why your alarm is getting louder and louder and louder. And it's the reason why once I've had somebody on an antidepressant for 6 months, their symptoms start coming back and I double their dose and it helps a little bit. But it's kind of like, I always imagine it like you're just throwing a blanket on this child and it's just like, here's a heavier blanket and they're going to freak out. Like they're going to get louder. So your alarm is going to get louder. And or the other thing is that child is just going to completely withdraw into what we call dorsal vagal shutdown and not talk at all and just go completely numb and dissociate. And that's no way to live either in this dissociated state. So it's learning, like, how can we bring these parts, as they say in IFS, how can we bring these sensations, as they say in somatic experiencing, and bringing them up and bringing them together so that they can be felt and processed and metabolized, as opposed to just sort of being medicated so that you can function.
I noticed in your book, you use the word heal anxiety a lot.
Mm-hmm.
Do you think we really heal anxiety, or do you think we just sort of like learn to live with it better?
I think it's a semantic, proposition. I mean, I say that my anxiety is healed because I feel my alarm now. And now I don't feel the compulsive need to go into my head and try and explain it with worry and explain it with trying to make myself feel better with intellectual things. So is it gone? No, but everybody has anxiety. Everyone has alarm. It's just part of being human.
Yeah.
Do I give it any credibility anymore? Not that much. So I think it becomes a cycle. Like when you get triggered by something, say, you were abandoned by your mom and now your partner is threatening divorce or whatever, that's going to come up in your body and that's going to light you right up. Now, can you expose that and see that basically that thing that's being lit up in you is the 6-year-old that never got the attention that they needed? And can you, as woo-woo as this sounds, can you go back and give them the attention now, see them, hear them, love them, protect them now in a way they never got back then? And there's ways of doing that are scientific. And this is what, this is, I hope, where we're moving with somatic therapy and IFS and that kind of thing into the more scientific realm, because it is starting to be studied more scientifically. Can we find that part in us that hurts and soothe it rather than just medicate it? Because then we can heal, then we can fix the hole in the floor of the boat. We're not just bailing water anymore. So it's really about, can we find these places? And when they come up, it's like, oh, okay, well, there's my bullied self. All right. What does my bullied self need right now? Well, they need some connection. Do you want to go to the driving range? Do you want to go play some golf? Do you want to listen to some music? Do you want to go play your guitar? Like bringing that child into belonging, as opposed to have them being a separate part that needs to be treated, was a massive key to my healing. So I like using the word healing. Am I anxiety free? No, I don't think anyone is.
Okay.
But I think what happens is that when that old alarm comes up in my body, and I know it really well in my solar plexus, it's like, okay, what else is going on? Like, what's happening here that's firing the alarm? And it's not, when people come in, there's a great saying in therapy. It's like, it's not about what it's about. Like when you come in and say, my wife's driving me crazy. It's not your wife. It's the fact that your mother did the same things when you're 6 years old. Like, it's just finding the root cause of this stuff and dealing with it at its source, as opposed to what you think is its source, which is usually wrong. And that's why treatment for mental health issues is typically misses the mark most of the time, because they're trying to treat the symptoms rather than going after the underlying cause.
Yeah. So the back of your book says renew your perception,
Yeah.
not your prescription.
Right.
I like that.
Mm.
Is it only perception though? Like, what about, diet, exercise? Like, I myself changed the way I ate and noticed I stopped biting my fingernails for the first time in my life. So you want to talk a little bit about,
well, it's a
beyond
lot.
perception. Yeah.
Well, exercise is probably the number one thing for any mental disorder is exercise. Nutrition follows closely behind, but exercise is the number one. The problem is when people are anxious or depressed, they go into dorsal vagal shutdown and they don't have the energy to exercise. So it's this vicious cycle that works against them. So absolutely nutrition. I mean, the book initially, Anxiety RX initially was over 200,000 words. So I
Wow.
had two editors go in there and chop it down to about 130. So the stuff about, eating better and exercising and stuff had to be kind of cut out of it, but I hope as I create more programs and more books and that kind of stuff, I can bring that into it. But the book was too big already. But
Yeah.
yeah, nutrition is like some people supplement, some people L-theanine is really, really helpful for them. Other people, it doesn't do anything. And L-theanine is kind of on the expensive side. It's not horrible, but for some people, it's really, really helpful.
Yeah.
Magnesium is cheap and it's very helpful in a small subset of people for anxiety. So that, those are the kind of the two that I kind of recommend the most. There are other things that are a little, more out there, more esoteric, that are kind of, not quite as good in general, but magnesium, try it. It's cheap, don't take too much or you'll get diarrhea. And then theanine, try that too. If you have anxiety in the morning, 4 capsules of theanine, I think is very helpful for a lot of people.
Mhm.
So it's a matter of, what can we do that in the supplement field, in the nutrition field, that optimizes our physiology, but ultimately it's
Mhm.
going back, finding that wounded child and showing them that they're seen, heard, loved, and protected. So if I had to say, exercise, eat perfectly, or find the child, it's finding the child. Like that's the ultimate route to healing. Now, those other things will help you get there, but to really heal, you have to go back and find that wounded child in you. And sometimes the child has just too much trauma to do it on your own. And some people need medication. I was trained in that. It's like some people do. A lot of people don't, though. A
Mhm.
lot of people don't. So it's a matter of like, how do we take everybody on their own individual traumas, their own individual sensitivity, and show them like, okay, well, this is the most ideal situation that we have for you. And
Mhm.
other people are very unwilling to go back and visit their traumas, and rightly so. So sometimes medication is an option for those people. So again, it's really treating everybody as an independent um, entity, so that we're not saying all medications are bad, we don't use them, or we're not saying that medications are the best thing, or we're not saying that somatic therapy is the best thing in the world, everybody should do that. It's like these are all options, and find what works best for you. Like, give yourself the best chance. Exercise, eat better, that kind of thing. Absolutely. Sleep is a huge factor, that kind of thing. Like, optimize your physiology, but ultimately you have to go back and find that child.
Yeah. I was talking to a friend of mine. He's actually a therapist, but he had significant childhood trauma, and I had some too. And we were talking about how, like, man, people who experience, childhood trauma have like sort of such a disadvantage at life compared to people who had like really stable,
Yeah.
upbringings. But do you think like the people who had the really stable upbringings can ever like know what it's like to have had that sort of struggle? Or like how
Maybe
can,
not.
yeah.
Maybe not, because like I said, like we said on the back of the book, renew your perception. That came from an email someone sent me years and years ago that said, Dr. Kennedy, I'm running out of my Xanax and I need a refill on my perception.
Yeah.
So that's where, yeah,
Misspelling.
and she
Yeah.
meant to say refill on my prescription. So it's like, can we find a place where we're accepting of all this stuff, and we see, and we're not overdiagnosing, and we're not overprescribing? I mean, of course, it's, there's always shades of gray in everything, but if we don't find the true root cause of stuff and treat the true root cause, we're always going to be chasing our tails. And I think in medicine, we're kind of chasing our tails. Now, psychiatry is difficult because psychiatrists deal with the most uh, difficult or ill or sick patients. So, you know, medications may be needed in that particular thing. But I think a lot of the general practitioners and that kind of thing, where we just automatically kind of go towards a medication, probably because it also takes, a year or two to get in to see a psychiatrist in Canada. I don't know what it's like in the States, but, there is this sort of urgency that you, as a doctor, you want to do something. I want to do something. And I'm trained in this pharmaceutical model. So chances are, if you go see the doctor with some sort of medical or mental ailment, you are going to get a prescription. And that's just how we're trained. And I don't think we should, denigrate doctors for that, but try and make them more aware that there are other options.
Yeah. So with you being a comedian, before we go, I just want to touch on humor. Like,
Sure.
what role do you think it plays in dealing with trauma, anxiety, mental health, you know?
Play. I mean, I think if you look at the studies on play, one of the things that play does is it activates the parasympathetic and the sympathetic nervous system at the same time.
Mhm.
One of the things that trauma does is it activates the parasympathetic and the sympathetic at the same time. So we lose that, it's kind of like a teeter-totter. When you grow up in a healthy, attached to an environment, when the sympathetic fight or flight is on, the parasympathetic rest or digest is off. When the parasympathetic rest and digest is on, the sympathetic should be off. But when you grow up in a traumatic environment, you don't really trust safety because it's usually, exploded with some kind of trauma. So we get this co-activation. So what play does, and humor does this too, is it co-activates the relaxation response and the activation response. And it shows you that you can be co-activated and still be safe. Whereas as a child, when you were co-activated, you weren't safe. There was, you were waiting for something or dealing with something. So play, this is just my theory. This has never been proven or anything like that, because I have all these little theories that go around in my head. But
Yeah.
I think because play co-activates the autonomic nervous system, and trauma does too, I think when you go to play and it co-activates the autonomic nervous system in a healthy, adaptive way, you kind of show that signature in your body of co-activation that it's not always painful. It's not always the end of the world. So that's where I think play really plays a huge role in healing.
Yeah. Okay. So I guess before we close, I just want to give you a chance to, maybe simplify everything down into one small take-home message for people who are just struggling with anxiety. Like,
Sure.
what would you say?
Well, I think the biggest message is that feel the anxiety in your body and allow it to be there rather than compulsively going up into your head with worry. Now, this is really easier said than done for sure, because as children, the only place we had to go for safety was our heads. So we keep going with that particular defensive adaptation because that was all we had. But now we're adults, we don't have to stick with that worry anymore. We can actually show ourselves that we can stay safe within that alarm, as much as it hurts. I think Pascal, you see him on the red carpet and that kind of stuff. You'll see him with his hand over his midsection. And that's basically where he feels his anxiety. So he's basically showing that anxiety, that younger version of himself, that he's still okay, that we're still connected.
Mm-hmm.
So you can do the same thing. Find when you get anxious or alarmed, as I like to call it, find it in your body. Stop looking in your head. The answer is not in your head. More questions. You can't solve a problem with excessive rumination and thinking with more rumination and thinking. So you really have to go into your body and find where you feel it. See that alarm as a version of your younger self that's still in that trauma, and see if you can pull them out, see if you can show them how you can help them. Now, again, I'm shortening things up considerably, but even just putting your hand over that area where you feel your alarm is helpful. The other thing that I tell my daughter says it's really helpful too, is just tell yourself, I'm safe in this. As much as I'm freaked out about, my dentist or the tax bill or whatever, I'm actually safe in this moment. Because people will tell me they'll wake up in the middle of the night absolutely freaked out. And I say, well, just say to yourself, am I safe in this moment? Like, I know I'm freaked out about this and this and this might happen. I might get cancer. I might have this, whatever. But in this moment where you're lying in your bed, are you actually safe? Are you actually okay? Because I don't think we sort of anxious people ever allow ourselves to feel okay, because there's always this baseline. Even if we don't feel anxious, there's always this baseline intensity that's in our system, like something could go wrong. So actively making the intention to tell yourself, you know what, you're actually really safe in this moment, and practicing that on a regular basis shows you it's an island of safety that you can create for yourself over the course of practice, over the course of years, where you can go to. So when you do get alarmed, you have this place where you can say, I know I'm alarmed right now, but I'm actually safe in this moment, which is something that your brain won't let you know when you're a child. But because you're an adult now, you can do it.
Yeah. Okay. So if people want to learn more, obviously you went into great detail in your book, and we'll link your book below for anybody who wants to get a copy and read it. And you also have a mind body prescription for healing anxiety program that they can find on your website that
Right.
will link as well. Is that like an actual, I mean, do you run those courses
It's a
or?
it's a program. So it's basically online. There's 9 segments to it. 7 of them are video telling people exactly what their anxiety is and what it isn't.
Okay.
And 2 of them are meditative. So one of the meditations is finding the alarm in your body. And the other one is a yoga nidra that allows you to process the old trauma and attach your adult self to your child self and your mind to your body. And if you can do that, you can start really creating a fertile ground for true healing as opposed to just coping. So I was really passionate about, like I said earlier, about the fact that therapy is $150 an hour. I priced it at $100. It's not $97. It's not, it's not a sales pitch. It's
99,
basically, yeah,
99.
exactly. It's not a sales pitch. It's $100. If you want to pay in 2 months, it's 2 installments of 50. And basically, it's something that will really help you, and it'll give you the grounding of everything you need to practice to be able to heal yourself. Now, again, if your trauma is really significant, you're probably going to need someone else. But this will provide you with a brand new way of looking at your anxiety and a way of actually healing it rather than just coping with it. So that's why I priced it at $100, because the other thing is that we put out free stuff before, and about 1,000 people download it and about 80 people actually do it.
Hmm.
So if you pay $100 for something, you're likely to do it. So
Yeah,
it's
there's
kind of like, okay,
value,
yeah.
attached to it.
And I think it will save people also thousands of dollars in therapy, because if you sit in CBT or talk therapy or whatever for 5, 10, 15 years, it's thousands and thousands of dollars. And I'm not saying it doesn't help, but it's not going to heal you. Like, it's going to help you cope, but it's not going to heal you. So providing you with this other knowledge, this other way of doing it, you can absolutely go to your CBT therapist, but you can also use the somatic practices as well, which will actually in synergy help those CBT practices work better.
Okay. So we're also going to link to your Instagram, which I think is your main
Yep.
social media that you're pretty active on.
Yep. At the
Um,
Anxiety MD,
okay. And then your podcast as well.
the Anxiety RX podcast. So the book is called Anxiety RX. The podcast is called Anxiety RX. And the book
Okay.
has sold over 50,000 copies as of July the 3rd.
Wow. Congratulations.
As a self-published book, that's pretty amazing.
Yeah, I'd say. All
Because it
right.
works. Because it works.
Yeah.
Most of the sales come from word of mouth. It's like people that read it and they go, this is a really different take on anxiety. It's really helped me see things in a different way. It's really helped me look at how I heal myself, as opposed to depending on some counselor or doctor or whatever, where I don't need medication, and I can actually start working on it and gaining some confidence that I don't necessarily need medication, that I can heal this myself.
Mhm.
Because I think a lot of what doctors do is we kind of take your power away from you. It's like, here, take this.
Yeah.
I'm in charge of your healing. Take this. And I think that does patients a disservice, because especially with emotional illnesses, is that we really have to feel like we're in charge, that we're doing it. Because one of the reasons why we developed the anxiety in the first place is we felt that we were powerless.
Mhm.
And the people that were supposed to look after us didn't.
Yeah. I like that. Okay. Well, thank you so much for sharing your
Thanks, Nicole.
experience.
Yeah.
Yeah. And any last closing thoughts before we go?
Well, the 2 things, like basically when you feel anxious, find the alarm in your body rather than getting sucked into your head, and just get into the practice of saying, as much as I'm feeling anxiety right now, I am actually safe in this moment, and practicing that as well. Those are the 2 things that will make the most difference in the short term.
Okay. All right. Well, thanks everybody for joining us for this live discussion. If you have not seen our film, Medicating Normal, and you want to, you can go to medicatingnormal.com/watch for the many ways you can view it. Thanks again, Dr. Kennedy, and everybody for tuning in, and we'll see you soon.
Thanks,
Take
Nicole.
care. Okay. Bye-bye.
Bye.